I would like to ask you permission to use this video for educational purpose and on the internet. Do you have your permission?
Yes, you do.
Now tell me about your pain before the surgery.
My pain levels was about 8 or 9 for a couple of years before the surgery.
Describe how pain level of 8 and 9 is. What did that mean to you? What could you do? What could you not do?
I couldn't do a lot of things. Sleeping was pretty much out of the question. Walking, sitting for over an hour, I couldn't do any of that.
Leg pain. Tell me about the leg pain.
Oh, the sciatic pain?
Yeah.
Yeah, that was a lot of pain. It went down the back of my leg, and it was pretty much constant.
Yeah. Now you actually looked into that, and you would talk to another surgeon, no names, but you talked to another surgeon about the surgery that could help you.
Yep.
Can you give me a little information about what kind of surgery and so on?
They said what they wanted to do is take some bone out of my hip and put it into my back.
Okay.
And it was going to be 6-8 hour long surgery.
6-8 hour surgery. Okay.
Yep. And then it was 6 to 8 weeks minimum for recovery.
6 to 8 week minimum for recovery. Okay. Now, what did you do then?
I had talked to a friend of mine, and he had told me about Inspired Spine. So I checked into it.
Okay. And you and I, we met. We went through the process, and once we noticed that we cannot make you feel better without the surgery, then we went and did that surgery.
Yep.
That surgery was done when?
September.
About 5-6 months ago.
Yep.
About 5-6 months ago. Now, how is the leg pain and how is the back pain you had before the surgery?
The leg pain is gone.
When did the leg pain go away?
Probably 2-3 weeks after the surgery.
And the back pain?
It's very minimal.
Very minimal.
Yep.
Now, I'm turning around and looking at the data of the surgery. We did that surgery in 37 minutes. We lost 100 cc of blood, about 1/3 of a cup of coffee. And you stayed only one night in the hospital, correct?
Correct.
So you went home next day after the surgery?
Yep.
And you were on pain medication for how long? About
2 weeks.
2 weeks. That's pretty good. Now we are 6 months out. This is what we did. We did a fusion, and fusion is perfect in that area. Bone is beautifully growing. With the surgery, that was 37 minutes and half a cup of coffee or less of blood, contrary to 6 hour surgery. And did they tell you how long you would be in the hospital and how long the recovery would be?
Recovery was 6 to 8 weeks. I don't recall how long I was going to be in the hospital, but I believe it was a week.
But we have the data. Open surgery, traditional surgery, you lose 10 times more blood. You stay 3 times more longer in the hospital. The recovery is sometimes 2 to 3 times longer than with this kind of surgery because we do just less damage. But more importantly as well, the risk of infection with the traditional surgery is about 15 times higher than with this kind of surgery, because in open surgery we cut the tissue, we cook the tissue, and just the result is that after 1,500 cases I had only 3 superficial infection and didn't have to take anybody back to surgery for infection, whereas open surgery has somewhere between 3 to 5% risk of infection. So all of that you're benefiting from. So I'm happy you found us.
Me too.
You came to us.
Me too.
So if you could go back in time to 2-3 years ago and to talk to yourself, what advice would you give yourself? Because that's the advice I'm going to give to people.
Go to Inspired Spine as soon as you can.
Actually, I have a better idea even. Look up your problem. There are lots of resources online. Get second opinion. Look up online, get information, talk to other patients, talk to more than one surgeon. I think that's the best advice I can give to anybody, to just research your problem. Nobody is more involved and affected by your problem than you yourself.
Right.
Get information. Yep. But I appreciate as well your trust that you say people should come to us. I appreciate that. Thank you so much.
Thank you.
Thank you.